Thank you, Sahani sir, uh, Dr. Neha Kathodia and Dr. Neha Kakar. Good evening, good afternoon, and good morning. This
Good
is the
evening, sir.
1687th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Prakash Rao. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30, and we have the international session from 8:30 to 9:30, and a local language session from 9:30 to 10:30. We are very happy to say that we are uploading the videos of the same on the very next day itself, so that those who missed the session can watch it again. You can subscribe it without paying any money, and you can share it with friends, whether it be a homeopathic lover or a homeopathic student or a doctor. The purpose of this forum is to take homeopathy to every house around the world. Let me come to today's guest. As you all know, our guest is Dr. Prakash Rao. Sir has completed BA, then PG in rehabilitation, and MD in homeopathy, and PhD in homeopathy. He is a retired research officer from CCRH Government of India. Has more than 30 years of experience at the CCRA. That's something great as far as every homeopathic researcher is concerned. And he has undertaken projects with UNICEF and AIDS Control Society. He's one of the person who has made maximum number of presentation in this forum on research aspect. And today, Doctor will be discussing about homeopathic aggravation and genus epidemicus part 3. As you all know, that Doctor has sir has presented 2 sessions on the same subject last month and by this month also. Anyway, let us proudly welcome the guest of the day, Dr. M. Prakash Rao, sir. Welcome, sir. Let me check another. Sir, you are using 2 devices? Yes. I have made you focus in 2 devices, sir.
Yes.
Okay.
Now changing the slide from my computer, talking from my mobile, sir.
Okay. You can share it now, sir. Everything is ready for you.
Okay, sir.
Yes. This slide is visible.
Sir, 1 minute, sir. Sir, can you see my slide, sir?
Yes. Homeopathic aggravation part 3.
Part 4.
Part 4. Sorry, sir. Part 4.
Okay, sir. Can you see my slide, sir? Yeah.
Everything fine. Type A.
Okay. Now, previously I have taken 3 parts of homeopathic aggravation. Now we are going to 4th part because of it needs exactly 2 hours time to explain total completion of my work. As we are limiting our time, I decided to complete in 5 parts this homeopathic aggravation. Now, I want to remind you because I know that today the participants will be less. So, I want to remind you the previous and the progression of the session. The last session will be the next session where it will comprises of the scientific explanation of homeopathy, where we design the protocols and the designing of the protocols and application of homeopathy and studying homeopathic aggravation in a scientific way. That means once the homeopathic aggravation is known in scientific way means we have already understood the pathology or the pathways of homeopathic medicines. So let's kindly go. Now, what are those homeopathic aggravations? Dose related type A, they are divided into type A, type B, type C, type D, and E. This is type A is why these have been divided into type A means we have to decide a research protocol to carry out a research in allopathic hospital. If we follow the protocol methodology, we will get the expected results. If we don't follow the protocol, we can't get the results. So first we have to frame the protocol. Next time I will tell you the protocol as well as the immunomodulation reactions and the drugs which we can induce homeopathic aggravation. Our protocol has made we can produce homeopathic aggravation with any of the drug of the homeopathy in any potency. Depending, even we can prove the drug on healthy human being in any mode of application. That means we can inject the homeopathic medicine, we can make the patient to inhale homeopathic medicine, we can make the patient to swallow homeopathic medicine, we can rub the patient the homeopathic medicine on his skin. So these are some of the experiments we have carried out. Those experiments will be shown next week because I want to remind you, if you just forget the basic this immunological reaction, which we decided in protocol, which we designed in protocol, then we will not understand the next final out of the pathways of the drugs that will produce homeopathic aggravation. So type A is dose related. It is pharmacological action of the drug, predictable from known pharmacology. We can take a pharmacognosy and pharmacology in our next session, but that we have all loopholes in our pharmacology even today. But despite of that, we don't have a condition to know that where we really stand in the scientific technology. It may hurt many people. So I will put in my polite language next time the pharmacology after finishing the homeopathic drug aggravation and genus epidemicus, because these both are related with immunology in modern subject. Then type B is not dose related, uncommon, no relation to pharmacological action of the drug. See, pharmacy is nothing to do there. Whatever may be the drug, if you give mother tincture, there will be homeopathic aggravation. Then there will be skin touch, there will be homeopathic aggravation. Nothing to do with pharmacology. Type A dosage, type B. Then type C, uncommon long-term exposure to the drugs. Always exposing self to the drugs that will produce homeopathic aggravation. Then prolonged exposure to drugs continuously for more than 6 months to 1 year. If one exposes as a pharmacist, or he will be in between alcohol preparations of homeopathic medicine, that will produce external homeopathic aggravation. Type E, termination of the treatment. We do not know. There are no textbooks or in classrooms that will be taught when you have to start the treatment, when you have to stop the treatment. What is the dosage? What is the duration of the treatment? And when it has to be stopped, like in allopathic treatment. If we ask somebody, our predecessors or some of our homeopathic doctors, they will say it is the vital force reaction, deep acting, miasmatic, depending upon the person to person. We cannot tell, but the modern technology, not modern technology, the science never accepts that. We should have a framework. So within how many days, suppose allergic bronchitis, peptic ulcer, tonsillitis, first grade, second grade, third grade, fourth grade, whether it is curable with homeopathic medicine, if it is curable in how many days, what are the other diseases associated with the patient, so how many days it requires, typhoid fever or simple viral fever, upper respiratory tract infection, chronic otitis media with the duration. So we cannot tell that we need 3 years. Warts, we cannot tell that we need 5 years to cure the warts. If they are warts that are genetically present, if the warts that are come from communicable diseases, They have to be specified time. And we have to see our literary experience, and we have to write in our textbooks that wards needs 3 months time to 3 years, depending upon the ward structure. Different wards have been given, different of timeline, modalities, drugs that are specifically used, but all they need is constitutional prescription, and it will come down. There is lot of work that has to be done scientifically in homeopathy, and whatever that work has been done, it is very good also in homeopathy. So these are the some of the things. Then type E, termination of the treatment. When to terminate this, we do not know. So I spoke about the termination of the treatment. Now, yes, then homeopathic aggravation in part 4. Now people, the students, the teachers, the homeopathic doctors, they are highly confused. No homeopathic, no CCH, or the Commission of Homeopathy, or the Central Council of Homeopathy, or the senior homeopathic doctors at think tank. They are not in a position to ask the students and the colleges whether to follow 5th edition of Organon or 6th edition of Organon. They take some of the aphorisms from 5th edition. They take some of the editions, aphorisms from 6th edition. They don't have enough dareness because they haven't done any research. So in that part, they do not know whether to stop the 5th edition of Organon or whether they have to discard. Hahnemann discarded himself, but our people are not in a position to discard the same. So this is the dilemma of the homeopathy. So in 5th edition, the slight homeopathic aggravation during the first hours is very good prognosis. Why I am telling all these things? The next time when I give lecture, you have to follow the immunology, and you have to understand the pathways of the drugs. When the pathways of the drugs have been understood, when they have shown the positive result, the total homeopathy is scientificized. One by one we can take out. But for that, we have to improve our pharmacological way, which is more backward, and which is totally not unitedly forming and not unitedly accepted by scientific world. Most of the scientists who are criticizing, who are critics of the homeopathy, they do not know many loopholes of the homeopathy. Otherwise, they could have discussed, criticized homeopathy more than what they are criticizing. When the similar homeopathic drug, similar natural disease is administered, it means no resistance because its action will be invaded by the similar. There is no resistance. The word no resistance never applies to homeopathic aggravation. Homeopathic aggravation is resistance and producing of antibody towards antigen. When the antigen is stimulated, when the antigen is swallowed or goes inside, that will be known as antigen. It will be understood by the body that it is a foreign particle. Then it will create antibodies. Those antibodies will increase in the size, and those antibodies will produce mild drug autoimmunological disorder that is known as homeopathic aggravation. This concept I am not adding. This is the scientifically we observed, so I am telling. So here there is no, our people will think that the body is weak. The body never will be weak at any time. Body always tries to subside the disease by increasing the antibodies. When the antibodies increases, that will be antibody and antigen quarreling in between. The antibodies will produce the toxic effects of their own secretion of the body, and there will be cytokine storm. That cytokine storm may, while curing, if we stop the medicine, and that cytokine storm automatically comes down. And if we give any medicine, that cytokine storm will increase. In COVID-19, you have seen the cytokine storm has killed various patients because the cytokine storm was not understood by all immunologists and allopathic doctors. They started giving anti-immunomodulatory functions. They started giving unnecessary serum. They started giving what you call the blood transfusion, and at the same time they started giving anti-immunological medicines, that is antihistamines. So antihistamines, the histamines present in homeopathy in human body, they quarreled, the disease aggravated, and ultimately patient died with cytokine storm. That's why here Hahnemann, 200 years back, never did we are celebrating his 278th birthday last day before yesterday on 10th, and that person without any microscope, without any facilities, he has made a concept that once the homeopathic aggravation comes, stop the medication, patient will improve automatically. So how to manage the homeopathic aggravation, I will talk in my next subject. Then the fifth edition, 275th aphorism. Suitableness of SC here. When a homeopathic drug similar natural disease, it means no resistance. This is what concept made by Dr. Hahnemann in fifth edition. He changed cinchona bark because cinchona bark is producing egg fever. That's why it controls the AIDS fever. In the same fashion, this particular 158th aphorism, particularly connecting to homeopathic aggravation, will be changed. If administered, it means no resistance. No, it means over resistance. This is the modern scientific technology, what we have seen and invented in our laboratory of immunology in Jipmer Hospital. Next time, I will also show the documents officially given to us for doing the research. Next, the fifth edition, a suitableness of the medicine for any given case disease does not depend on its accurate homeopathic selection alone. We see, but likewise on the proper size rather than this is the absolutely 275th aphorism is totally connected with the immunology. Please kindly go back, kindly see the 247 aphorism, then see there we found it is resistance, it is not resistance, it is antigen, it is the overreaction. There I was forced to change and understand homeopathic aggravation. But here in 275th aphorism, whether he has studied immunology 270 years back or does he know immunology when the immunology is not developed, these are all the surprising concepts of scientific interventions of the see whatever that is present in immunology that has been written by Dr. Hahnemann. The suitableness of a medicine of any given case of a disease dose not depend on its accurate homeopathic selection, that means similia similibus currenter alone, but likewise on proper size, that is dosage, rather than smallness of the dose. The size, the dosage, repetition. What is the size? One is dosage. Second is daily repetition. How he understood all these things, the immunology, it really surprises. There, I told in my last, this one, it is resistance. No, it is overreaction. Here, it is, I am totally agreeing with this. This will make us to shed tears as a scientist when I understand this, how this person has understood so much of knowledge. He could have changed his sixth edition also. Was I have been there at that time, and this immunology is present with me and Hahnemann. So again, twofold. Such increase of the original symptoms of chronic diseases can appear only at the end of the treatment when the cure is almost or quite finished. See, in 247 aphorism, everybody thinks that homeopathic aggravation comes with the first dose of the medicine. That is also possible. And but whereas 240, see, it is in practice, it has been misunderstood. So that is not possible. The homeopathic aggravation comes in chronic disease only in the last evolution of 50 millisimal scale potencies. And the sixth edition says by Hahnemann, revised large listed in 1942. And this history you know very well, I need not explain. So in sixth edition 281 aphorism, the patient is left without any medicine for 8, 10, 15 days. Meanwhile, they given him the sugar of milk. See, this is where he avoided the present cytokine storm understood by the modern technology of the immunology. And he told no medicine. For COVID also, no medicine. Just bringing down the fever, that is sufficient. But the fellows never understood the cytokine storm has killed various persons because of the intervention of various medicines under one confusion by the doctors because they do not know anything. Because all allopathic doctors are responsible for dying of so many persons under the name of scientific interrogation and lack of knowledge. We cannot take any action about them or for them to them, but we can understand the science has done so much of like mistakes, errors. See, like tubercular sanatoriums, they built in 1960s various sanatoriums. The sanatorium theory came because the tuberculosis patient has to be kept away from people. But by the time you diagnose the tuberculosis, it will take 3 months time. So he infected many people. So the concept of constructing sanatoriums became useless, and government has wasted by constructing tubercular sanatoriums all over India. One of the popular sanatorium is CMC, Vellore Sanatorium in those days, very popular in South India. These are many foolish works will be done by the scientists, and the cytokine storm is one of the foolish work of the latest scientists, and where homeopathic Dr. Hahnemann in his 6th edition, 281 aphorism understood, only sugar of milk is sufficient. The complaint will disappear in few days or in hours if during these days without any medicine. So whoever was admitted in ICU during the COVID time, he came out because his cytokine storm was not disturbed. God has given him 100 years of life. So he came out, and who was treated, who was transplanted blood and everything. See, unnecessary, they have given what you call see, serum and blood transfusion and everything. They started taking blood samples, and they cleaned all the RBC. Only WBC was transformed, and that is found to be a placebo effect. But how many liters, tons of the blood they have transported, that is all now understood. This is the where a paradoxical state of the science. If he criticized this, when that liver person who criticized, he was given fitting reply, he told sorry also. But who has to criticize WHO and allopathic doctors that they have done the foolish work of transfusing blood? So many tons of the blood. At the same time, in the night overtime, to antidote the cytokine storm. So this is the foolish work. And later, now the studies are coming, the blood transfusion, the serum transfusion, the WBC transfusion, everything found to be a placebo effect. And they daily criticize that homeopathy is placebo effect. So who is the culprit here? We have to understand properly. For that, we have to develop the proper knowledge of homeopathy and application of the science to homeopathy that is already scientifically present, and that science has to come out. So, factor responsible for nature of the disease, chronic disease, homeopathic aggravation, filthy. See, nature of the disease, acute disease, chronic disease, homeopathic aggravation felt within few hours. And in disease, acute disease, in chronic disease, homeopathic aggravation felt within few weeks or at the end of the curability of the disease. So condition that constitution of the patient were observed: hysterical patient, nervous patient, hypersensitive patients, idiosyncrasies patient, weak constitution, physically weak, who will get infection, that is a child or the old persons, when the degenerative condition is more present. So most of the bacteria virus will affect. Here, if I talk about the virus or bacteria, people, homeopathic doctors, some of the old homeopathic doctor will say it is not the virus or disease, it is the present body. We have to treat the body, not the disease. They are all blah blah. Disease and body is one and same, and disease is part of the body. Drug is the part of the nature. Disease is part of the nature. Bacteria is having life. Virus is having life. Protozoa is having life. Fungus is having life, human being is having life. So the vital force present in virus will definitely affect the vital force of the human being, because the virus has to finish its time of life. At the same time, the human being has to complete his lifetime. Now there are many drugs coming out to increase the age or the what you call the lifespan of the human being, whatever it may be. The genetically designed human being life will have only 100 years of age, and that 100 years only the doctors will work as a repair the body, but they cannot give the age. So this is where our homeopathic doctors have to come out, that we are treating the patient, not the disease. We are treating the disease, not the patient. They all are different terminology of the English literature. but the destination goal is same for homeopathic doctors. That literature, English literature, never helps in science. So dosage and potency. These potencies, dosages are fifth edition. So now in sixth edition, there is no dosage, no potency. I told in the beginning itself, our homeopathic doctors think tank, our commission rate of homeopathy, our Central Council for Research in Homeopathy, our homeopathic doctors, our all the experienced persons all over the world are not in a position to discard fifth edition of the organon, which was discarded by Hahnemann. See the fun. This is where we have a loophole in our homeopathy, because all the time that has government given an opportunity to prove the drugs on animals, our homeopathic doctors have gone behind because they were not having self-confidence. You take any doctor who treated Raja Ranjit Singh to a young fellow, but nowadays they are talking about how to treat animals with homeopathy, and veterinary homeopathy is safest homeopathy, and proving medicine on veterinary homeopathy, and homeopathy veterinary treatment is becoming more popular than homeopathy on human beings treatment. See how ignorant people used to be. I am not criticizing their individual, their devotion towards homeopathy, but how the accepting the new things was not present with our old doctors, that has killed homeopathy. And now we are facing a type of criticism from the allopathic doctors, a Tom and a Dick and Tom, everybody will criticize. The reason is our old homeopaths were having the old habits and not in a position to digest and accept the new concept. Now they are giving agriculture homeopathy, where I have done the research. I have taken the veterinary research, and we are also taking human being research. This is not understood by any homeopathic doctor at present in India, except Dr. Danesh, Dr. Kurup, Dr. Manoj, and you people, because I am continuously speaking to you. Then homeopathic aggravation, confusion in between adverse events. See, Hahnemann has also written in his sixth edition as well as in fifth edition. This Hahnemann is very intelligent. He understood what is adverse reaction. That is, the toxic effects of the drugs are known as adverse reaction. What are the adverse reaction? The ipecac. Ipecac first produces cough. Ipecac produces vomiting. Ipecac produces pain in the abdomen, and ipecac produces loose motions. Ipecac produces blood vomiting, blood motions. So I am comparing one drug, Ipecac. Ipecac, what is actually prescribed in homeopathy for wheezings and as well as for cough. That is over. It may reduce the wheezings, it will reduce the cough. Then pain abdominal will come. Then patient will follow loose motions, stools, tenesmus stools with blood. That means it is the toxicity of the ipecac. And bleeding from uterus in the women. That is the physiological action of the crude form of the ipecac drug. And what is the quality physiological, another quality of physiological action of ipecac? If given in low potency and mother tincture, it will work as a vomiting medicine. In olden days, before 1940, the ipecac used to be present in allopathic hospital to make the patient who comes after swallowing of the poison to commit suicide. That poison will come out if they give the mother tincture or decoction of the ipecac, it will come out. So in homeopathy, these all reactions will come under one group, and one homeopathic medicine is ipecac. But it will be very effective for acute bronchitis and cough. It will be less effective for uh, dysentery, and it will be more effective in a specific patient who is having autoimmunological endocrinal disorder with bleeding. So most of the doctors, they say that I gave Laxis, I gave Crotalus aridis, I gave this medicine, that medicine for bleeding for a woman. Then at last I gave Ipecac. When Ipecac were autoimmunological mechanism, where the blood factor number 8, such as hemophilia, there the ipecac will be very effective. That's why they are in a position to cure the bleeding from the uterus, that they do not know. But when we were carrying out our research work, we found the efficacy of the ipecac in hemophilia on cytokines. So this is some of the research outcomes. So important for physician clinician to understand concept of the adverse. What is adverse reaction? When you have prescribed ipecac for cough, patient developed dysentery. That means he is having immunomodulatory condition. And I am telling another one, a drug, why we cannot cure any disease with single drug or single potency. But we are forced to give single potency of the single drug depending upon the situation. Because the drugs that have been proved are in 6 potency, in 30 potency, in 200 potency, in 1M potency. So some of the drugs have produced a symptom in 6 potency, 30 potency, 200 potency, and 1M potency. More than 1M, Dr. Hahnemann has not tested. Hahnemann has proved 99 drugs. We will take the standardization of protocols only with Hahnemann philosophy, not with anybody who added something without doing any experiment. Hahnemann did experiments. So that's why the homeopathy, Hahnemann are synonym. It is not Kent or Robert. Their contributions are excellent for teaching and understanding. They are better teachers, but they are not Hahnemann. There is no separate, there is no constitutional homeopathy, there is no predictive homeopathy, there is no Bombay Pandits homeopathy, there is no somebody's cancer homeopathy protocols. There is one homeopathy, that is Hahnemann homeopathy. So adopting safety precautions. These aggravation, these adverse reactions were discussed. When we treat the patient for cough, he may develop one adverse reaction. If we treat a female, about 14, 15 years girl, for chronic bronchitis or tonsillitis or cough with ipecac, she may develop the puberty symptoms. These are some of the adverse reactions of the drug. He described everything between adverse reactions and homeopathic aggravation. Then homeopathic aggravation. What are the factors that will lead to potency chosen? If you select 30 potency, higher potency is more likely to cause aggravation. If not matched well, inappropriate prescription is very common. No drug in our chest or in pharmacy will come and tell, I am the suitable drug, sir, I am bryonia, I am suitable to this patient. Kindly give me, or I am arsenic, I am conium maculatum, I am phosphorus, sir, kindly give. It is our assumption. And if another homeopathy doctor sits in front of you, if he takes case, he says phosphorus, you say arsenic, other fellow will tell sulfur. So in homeopathy, it is your decision. Thinking that it is you are giving the similar drug. So the similar drug will be changed. Double-blind studies, we found out that the homeopathic aggravation will depend upon potency chosen. Then patient sensitivity. Children, elderly, I told already, old patients. Depth of pathology, chronic versus acute disease, frequency of repetition. Everybody will give a lecture and ask that I am a single medicine prescriber. We have records from the topmost doctors who won the Padma Shri Award to local Lions Club Award. I have records to prove that, but we don't want to discuss all these things in a seminar. Nobody in homeopathy. There are few homeopathic doctors, very good homeopathic doctors, who will do single remedy, single prescription. They change the remedy and single prescription because the art of practice is something different and the theory of practice is something different. For the survival of the fittest, today world is survival of the fittest. So the art of the practice, most of the doctors will have their shops because they should develop their financially well. They have to develop financially. So what they do, they prescribe either 2 to 3 drugs with shampoo, with soap, with hair oil, everything because they have to survive. So that's why Hahnemann made homeopathy as the science and art of homeopathy. Miasmatic background, these miasmatic salts are also concepts. These concepts are what is the starting of Sora, what is ending of the Sora. Can anybody in India will tell? If take a case, everybody will discuss. This is psychosis, this is Sora, that is that symptom, this is this symptom. And if it is that symptom, what is the scientific ability of the borderline of one of the miasm? Can anybody tell? Nobody can tell. They tell their concepts. If we don't listen to them, they tell that we are adamant, but they don't want to. The theory of the scientific ability, they cannot explain because it is concept. They think that concept is more powerful than the science. This is what happens with our old homeopathic doctors. See, don't think otherwise. I am listening to Hindi lecture. This is miasm. Don't, I never say miasm or thing. So, but what is the miasm in this particular disorder? Where starts that miasm? How you are applying concept to a modern technology? So that concept has to be proved scientifically. But make physician to understand Vata, Pitta, Kapha. The relationship in Vata, Pitta, Kapha is done, that patient will expire. If the Vata is alone exists, patient will be cured. If Kapha is alone, patient will be cured. In homeopathic also, if it is psora, syphilis, psychosis, tubercular or multimiasmatic disorder, it will become one-side disease and patient will expire. A one-side disease can be palliated, managed, temporarily treatment will be given but can't be cured. Cirrhosis of liver, side effect, hepatosplenomegaly. Hepatosplenomegaly will produce arterial hypertension, that is portal hypertension. The portal hypertension will produce enlargement of the heart. The enlargement of the heart, portal hypertension will bring hypertension. That hypertension will bring spoil the kidney, and that kidney will spoil the total system. There will be black, then next stroke, patient will die. In that case, and only management is possible with either allopathy or homeopathy or with Unani or with Siddha. These are some of the limitations one must know. We cannot apply. There Hahnemann understood with his concept. When it is double complex disease, this is the limitation of the treatment. When it is simple sora, it is curable. Skin disease. Simple psychosis, curable. Simple syphilis, curable. Tubercular miasmatic effect. See, cancer. When you are not accepting homeopathic diagnosis, why you are taking tuberculosis miasm? When you are not accepting the diagnosis, it is the treatment of the patient, not the disease, then why are you accepting cancer miasm? So they, all the scientists, all the homeopathic doctors in India who don't follow the modern science, they are confused in their own concept and in their own world. Writing a drama, a poetry, Shakespeare, Othello, is very easy, but writing a physiology, pathology book is toughest task because we have to tell truth. Art won't work. So temporary intensification of the existing symptom follows well matched remedy, sign of healing. These are some of the things. Now, again, I am telling this, you should not forget next week, because the next week total topic will be immunology, drug action, pathways, and how it will produce homeopathic aggravation, what has to be done. So, what is immunology? Immune system, body's defense plus regulation. Homeopathic aggravation, possible immune activation event. The possible immune activation event is not a concept, a proved theory in immunology. This happens, possible immune. Why possible immune? The homeopathic aggravation percent of the patient is 1 patient among 10,000 patients, because that particular drug will produce the homeopathic aggravation. So the first prescription itself, homeopathic, see, already patient is coming with fever. Everybody runs, see, homeopathic aggravation, came, patient may die. Homeopathic aggravation, Hahnemann is assuring you that patient will improve. Why the doctor, physician is confused and tense? Because he do not know the difference between homeopathic aggravation and disease aggravation. Homeopathic aggravation, possible immune activation. Aggravation side effect, physiological healing response. Vital force, what is vital force? Immune intelligence. What immune intelligence? The cytokines will produce the antibodies. The cytokines will produce antigens. The cytokines will quarrel among themselves. The cytokines may improve anti-inflammatory cytokines. That means the body is producing anti-disease product. Patient will improve. When patient improves, the cell-to-cell communication will be very good present. The cell-to-cell communication is pathological cell, immunological cell, respiratory cells, cartilages, and neurons. When the neuron gives one see, if we put a electric switch, if we switch on, the current will pass from the switch till the time where current is staying, then it will be in switch box. In the same fashion, the immune mechanism, cell to cell communication will takes place, the immune intelligence will takes place, and if you switch on the current electric switch, tube light may come, fan may come, AC may come, depending upon the function of the organ that is present. In immunology, the cytokines, anti-inflammatory cytokines will be produced. When anti-inflammatory cytokines produce, this will be taken by nerve cells, that is axons and dendrons and neurons. That neurons will tell to the nervous system, see, I got the enough strength from immune mechanism, wake up, the block in the cells must go, you kindly driven out, and the immune mechanism cell to cell structure will produce kinetic energy, and that kinetic energy will come to muscle cells, and that muscle cells will produce more protein, and the patient who is in coma, he may start moving. This is the kinetic energy that is present in the body. The kinetic energy is present till the vital force is present. What is vital force in immunological word? And that is known as immune intelligence. Till the life is there, we are talking. If life is gone, see, after life, what are the, see, why I am telling, after within 1 hour, we can donate the kidney, within 1 hour, heart, within 1 hour, the eye, within 1 hour, the kidneys, within 1 hour, liver. So this is cadaver donor transplantation. Life expired. Now liver never functions, kidneys never function, brain never functions, heart never recovers. So immune intelligence has been disappeared. This is where Hahnemann understood the vital force. That's why he changed the word vital force to vital energy. How intelligent, beautiful concept, which he never touched immunology or pathology. If that person is present today, he could have got 100 Nobel Prizes. Homeopathy and immunology. Why not? Miasmatic imbalance. This is, what is miasmatic imbalance? Why I took this word when I told that tubercular miasm? No, miasmatic imbalance means vata, pitta, kapha, carcinogenic, malignant, tubercular, pathetic condition, digestive, endocrinological disease. See, that's why what happened, tubercular miasm came, carcinogenic miasm came, malignant miasm came. In the same fashion, allopathy also, malignant patient, immunodeficiency patient, endocrinology patient, respiratory patient, pulmonology patient, these are nephrology patients. So this is, I put, instead of telling each system, I took it to homeopathy converted, immune dysregulation. When immune dysregulation comes, from which part of the body we do not know. Remedy action, immune modulation. What is our homeopathy will do? It will produce immune modulation. So this one must, I request all the delegates to remain for next topic. So minimum dose, this is immune threshold. You are giving minimum dose. Minimum dose means 30 potency, 1 dose. 200 potency, 1 dose. If you think 200 is a lower potency. Or 6 potency, 1 dose. 6C I am talking. So low potency is gentle immune nut. It will go and it will produce that antigen. The body thinks the foreign particle came into the mouth. So antigens will come. This is immune threshold. That is the minimum dose. This minimum dose theory Hahnemann kept. He want to wash away the toxic effects of the drug. He want to stop the barbaric treatment at that time present. That's why he introduced potencies. High potencies, aggravation may reflect because he mixed it. he succussed the medicine. He thought that it will produce hypotency. There it is little error. A drug that produces symptoms in low potency may not produce the symptoms in high potency. So till the drug has produced a symptom, he tried his level best up to 1 potency, 1 M potency, and he got the symptoms. So when you are reading a drug, you kindly go to Hahnemann proving if the Palistilla has given the symptom in 30 potency or 6 potency, if you give that apply potency to this patient, you will get fantastic result. The pharmacology knowledge and material medical knowledge has to go hand in hand. With that, the pathology of the disease knowledge. Aggravation may occur if potency exceeds threshold. That is, the immune threshold has increased. That means we are giving 10M, 50M or CM. But here we are thinking the diluted medicine will have more medicinal effect under the some theory, some quantum theory. No, it is not like that. The diluted medicine will not have any medicinal like the lowest potency, but the whatever that is present in the lowest potency will present in higher potency also. But when it will react in repeated doses, it reacts very fast. There the homeopathic aggravation comes. This is known as mirror hypersensitivity reaction in immunology. What is mere hypersensitivity reaction? I will compare for your understanding. That is, if we stand in front of mirror and if we focus a light on the mirror, if we are red, if we are wheatish color, if we are black, or if we are white, so our face will glow in that color. The glowing of the face, we are putting the torchlight or light behind our head. If we focus on our face, the mirror never reflects. But if we reflect the mirror mirror reflect will fall on our face and our face will glow the whatever color we have, which is not true. We will see our face. This is known as mirror hypersensitivity reaction. We have to salute Hahnemann. That's why he told the homeopathic aggravation never requires any medicine. It is a good sign of improvement. You kindly stop the treatment there. Only make some of the manage homeopathic aggravation by giving rest, by giving him more water, and patient will be cured. This is the removing light behind our head when we are standing in front of mirror. There the glowing color from our face will disappear. Absolutely, we need not break the mirror or we need not make makeup to our face. In the same fashion, the mirror hypersensitivity reaction in immunology is known as homeopathic aggravation, which needs no medicine. This is experimentally proved, which you are going to see in my 5 part number 5. Then, which are the remedies? They studied, they thought, because they have given these remedies. This is from literary research. Sulfur. Whenever you repertorize, there will be 4 to 5 remedies. I will tell you again and again. First arsenic, second sulfur, third calcarea car, fourth lycopodium, fifth palastrilla, sixth sepia, then silesia. These 7 drugs will come under your repertorization for all the symptoms. Because number 1, they are well proved that. Because number 2, they were being prescribed by everybody. Number 3, in 99 drugs of Hahnemann, they were the first dosage of the drug. So if you go to any clinic, either government or a private clinic, you kindly see your pharmacological room. You will be going on ordering arsenic, lycopodium, nux vomica, sepia, palassatilla, sulfur, rustax, econite, belladonna. Your zincum metallicum, zincum arsenicum, mercurius, nigrum, rubrum, heparsulf, sometimes heparsulf, and rhododendron. These medicines you never purchase. Zincum metallicum, meserium, though they are polycrest medicines, though the dosage never. See, sometimes we also are not in a position to open zincum arsenicum nitrum or arsenicum sulfatum flavum. Arsenicum sulfatum rubrum is the medicine for leukoderma. That medicine never ends. Seal will be like that. So why? Because we are the well-proved remedies. Polycrests are 126, but the usage medicine will be 9. So the lycopodium, they are deep acting. Every medicine, deep acting, small acting, that acting, this acting is only a literary word. It is not antibiotics. But when the other persons, apart from Hahnemann, thought and they compared themselves with modern medicine, they started putting this deep acting, small acting, slow acting. Every drug will, aconite is complementary to sulfur. How it is possible? And the calcarea carb is complementary to belladonna acute drug. So when the drug relation comes, that person who worked on drug relation scientifically, but this person never accept that aconite is complementary to sulfur. Which aconite is the shortest remedy. The complaints will come and disappear within 24 hours. How it become complementary to sulfur? These are some of the things which you have to scientifically think always. The elderly people speak on dais, whatever that comes. Where is the history showing one video or anything? It is the evidence number 7. The evidence number 1 is the drugs pathological pathways in the body. So second is lycopodium, because the drug is safe from plant product, Naxwamica, arsenic album, and these will call deep action, high reactive, because they will produce mental reaction, mind symptoms. Arsenic album, highly sensitive person. So in the same fashion, natrium, phosphorus, calcarea carb, igneous, sorinum. See, they thought like that. Deep acting polycrest, sulfur, lycopodium, natrium. I am not telling about the symptom. High reactive symptom. So these I am also not talking. Emotional remedies. They themselves describe these are emotional remedies. They are no source. They are plant kingdom remedies. These are the mineral remedies. Somebody will stand mineral remedies. Somebody will tell some new word, biotechnological, see, botanical medicine. All nothing in front of pharmacy. Medicine is a medicine. No source prepared from the body. No source are they prevent the disease. No, it is wrong. They never prepare, no source never work as preventive medicine for the disease because they are proteins. Protein never will be absorbed through mouth. Protein has to be given as an injection. These our fundamental doctors do not know. Somebody produced COVID-19 also. If I tell the same thing on dias, I will be criticized more. He don't know that he don't know, and he also never understands what he has to understand. So this is the problem with our doctors. Then sulfur, sorinum, thuja, tuberculum. No-sod is one of the medicine. No-sod is not a preventive medicine. Then belladonna, aconite, bryonia, the acute remedy. If aconite is acute remedy, why it is the chronic for sulfur? Complementary remedy for sulfur. This is our concept, not science. So then this is the last slide I have shown. So kindly, I request that I assured last time that I will spare at least 5 minutes for discussion. I request you to kindly have a discussion. Next time, I will tell you the pathways of the drug, totally immunomodulation theory of homeopathy, and you kindly remember this vital force, immune intelligence, immune modulation, and mirror hypersensitivity reaction immunology. This is homeopathic aggravation. Please,
Yes,
so that I
yes,
can deliver the next lecture.
yes, sir.
Sir,
Yes, sir.
now
Yes, sir.
time
It
for
is,
this.
as you rightly pointed out that the real mirror image mechanism is there in our homeopathic aggravation. There is no medicine required for homeopathic aggravation. As you right, just you can take a little bit of water that will definitely bring back the patient to normal, and the cure has been started by then. And it is a time for discussion. I inviting Dr. Uh, Mariam Salcedo to begin the session. Dr. Mariam, please ask Dr.
Yeah,
And
am I audible?
yes,
Yeah,
Yes,
yeah.
sir. Yes, sir. Yes.
Yeah, yeah. Sir, it was a very nice learning for us. Very new things are clear. One small question comes to the mind, like how does a homeopathic aggravation differ from a natural progression of a disease, specifically the chronic disease? We get confused in that. So kindly
Yes.
highlight some views about that.
Now, previously, I told the adverse reactions and homeopathic aggravation. The adverse
Uh-huh.
reactions of the drug. Now you are
Yeah.
asking about the chronic diseases. The chronic diseases usually the natural disease symptoms will increase. Pathologically, there won't be any improvement. After giving homeopathic medicine, the pathological degeneration will start. That means a patient is going for aggravation of his disease condition. If he is mentally all right, though pathologically he is unhappy, or if pathologically unhappy with our investigations, we have to give little time. When the suppose I will tell you, in a diabetic patient, a chronic patient, diabetes, hypertension, which will spoil the kidney. The diabetic hypertension is a chronic double complex disease. When the double
Yes.
complex disease comes, in the double complex disease, the homeopathic medicine has to be given only to control the disease, not to cure the disease. We have to know our limitation. It is written in our 70th FR, what are curable, what are incurable, what are the limitations. So in that what happens, the pathologically, the serum creatinine secretion or albumin secretion will be there. If it is homeopathic aggravation, patient says, sir, you don't worry about urine reaction. After some days, drinking more water and walking may reduce and patient feels better. With you can give medicine along with the allopathic medicine. This is known as integrated approach. But in sometimes what happens, the patient never respond and pathologically patient will become growing worse and worse. No homeopathic medicine will work. At that gasping breathing will come. Chronic bronchopneumonia will develop in homeopathic patients because the doctor never stands under the disease condition. The chronic pneumonia in old age is very common and it kills the patients. So where the pathological improvement is not present, think that it is not homeopathic aggravation, it is only pathological aggravation. The fever has to respond, it has to come down, then it has to increase. But without touching normalcy, the fever is continuing means there is something danger in the body. The infection rate is highly present. Within 24 hours, if you give an acute cases, one homeopathic medicine, the fever has to touch normalcy. Then let it increase in the evening. See 4 to 8 aggravation in lycopodium. For which disease he has to write? It is being generalized. So such type of writings, literary writings will not help for a scientist. So
Okay, sir.
this,
Thank you. Thanks for the explanation, sir. Yeah.
Okay, it is the time for vote of thanks. I am inviting Dr. Musk to say a vote of thanks. Yes, Dr. Musk.
sir, this time I managed the time.
Okay, sir. Okay, sir. So Dr. Musk is not responding. So Dr. Manoj, please.
Thank you, Dr. Tanesh. Well, let me add one sentence. The aggravation of his own disease is the homeopathy aggravation. Please read through aphorism 157 because a lot of serious reading is needed without a pathological concept will lead to your homeopathy. So on behalf of IFPH, I am expressing sincere thanks to Dr. Prakash Rao and all those participants in the session. Thank you.
Thank you, Dr. Manoj, Dr. Prakash Rao, sir, and those who attend the session. And with that, we come to the end of the day 1687. It's over to Dr. Ajini Maliyakal to moderate the Malayalam session.